After your baby is born and you have had some time to do skin to skin and give your baby their first feed, the midwife will offer to weigh and check your new baby. This initial examination is a top-to-toe check that also includes checking their temperature, listening to their heartbeat and listening to their breathing. The midwife will also weigh your baby and measure their head circumference. If anything is identified at this check, you will be informed and a neonatologist or a baby doctor may attend to also examine your baby and have a conversation with you. During this examination, we also offer to give your baby vitamin K. We hope that you have had some time in your pregnancy to discuss what vitamin K is, how and why we offer it, so that you can make an informed decision, but the midwife will be happy to answer any questions you may have on the day. What we refer to as vitamin K is an important group of chemicals which can help our blood to clot. We offer this to your baby to help reduce the chance of complications from excessive bleeding known as vitamin K deficiency bleeding, or known as hemorrhagic disease of the newborn. This condition is very rare, but it can be serious, which is why the parents of all babies in the UK are offered a dose of vitamin K, even though almost all babies will not benefit from it. There are two methods of giving vitamin K to your baby, should you consent, and these are an intramuscular injection or oral. The intramuscular injection is generally given during the initial newborn check shortly after birth and is given into the baby's thigh. The injection is very effective against the classic onset of VKBD, with evidence that shows rates drop to below 1 in 100,000. The oral option is given directly into the baby's mouth following a feed, and in the UK it's normal for 2 to 3 doses to be given depending on how you're feeding your baby. Babies can, however, spit up the oral dose, which does make it difficult to know how much of the dose that they have swallowed. Evidence suggests that babies who do not receive vitamin K, the risk of the baby developing VKBD is 1 in 10,000. Should you wish for your baby to not have the vitamin K supplement, it is important that you discuss this with your midwife and neonatologist so that you're aware of any signs and symptoms and the correct actions that can be taken if required. In some cases, your baby may require observations for the first 12 hours of their life to identify any signs of infection. All observations include a temperature check and listening to your baby's heart rate and breathing using a stethoscope. This list is not exhaustive, but the most common reasons for these observations would be thick or thin meconium. This is when your baby opens their bowels before birth and your waters are a green or brown colour. Group B streptococcal. GBS is a type of bacteria that commonly lives in the rectum or vagina, and most adults will not be aware that they have this. However, it can be serious in a newborn. This is, however, something that we don't routinely screen for in the UK. Pre-labour rupture of membranes. This is when your waters have been broken for more than 24 hours before your baby is born. If you have had gestational diabetes in your pregnancy or there are concerns regarding your baby's blood sugars, you will also be offered blood sugar monitoring for your baby through a heel prick blood test. If your baby has 2 consecutive normal readings, then this testing is complete and there will be no further requirement for any other tests. You will also be offered hearing screening for your newborn, and this can be performed within the first 3 months of age. It may be performed in the hospital, or you may receive a letter for a community appointment. Sometimes the hearing screeners will be unable to get a clear reading so soon after birth. If this is the case, you will receive an appointment for further screening in the community. Moving on to jaundice. Jaundice is a common and usually harmless condition in newborn babies that can cause the yellowing of the skin and the whites of the eyes. If you are in hospital for more than 24 hours after your baby is born, your baby will be offered a TCB check. This is a small monitor that shines a light on your baby's skin and calculates the levels of bilirubin. If the levels are high, your baby may require further testing via a heel prick blood test to determine if treatment for jaundice is required. It is important that you continue to monitor your baby's jaundice at home and to contact the maternity helpline if your baby's symptoms are becoming worse. Symptoms may include the yellowing of the skin and the whites of the eyes, yellow urine or pale stools, reluctant to feed or difficulty waking to feed, vomiting and lethargy. If you are unsure, it is always best to contact your midwife for reassurance and support.